The dangers of teething remedies. The U.S. Food and Drug Administration (FDA) warns against using any sort of topical medication to treat teething pain in children, including prescription or over-the-counter creams and gels, or homeopathic teething tablets. They offer little to no benefit and are associated with serious risk. The use of benzocaine gels, sprays, ointments, solutions, and lozenges for mouth and gum pain can lead to a serious, and sometimes fatal, condition called methemoglobinemia, in which the oxygen-carrying capacity of red blood cells is greatly reduced. These remedies used erroneously by mothers for perceived teething problems are of no benefit, and some are harmful to these children, like the teething mixture, which contains diethylene glycol, has been implicated in the etiology of acute renal failure in children and was reported nationwide. Please subscribe to our channel so that you can continue to get information about how to stay healthy. But the use of drugs for teething can often do more harm than good. There are many myths and misconceptions surrounding teething and its remedies, some dating back to ancient times. In the past, teething was often falsely attributed as a cause of death in infants. In 1842, it was falsely reported that teething was the registered cause of death in 4.8% of all infants under the age of 1 year and 7.3% of those between the ages of 1 to 3 years in London. In 1910, 1,600 deaths in England and Wales were falsely recorded as being caused by teething. In Chinese medicine, teething is seen as an outward manifestation of a strong developmental phase. This means children need to conserve their energy rather than expend it on too many external activities. In Africa, many symptoms have been associated with teething in children, with the possibility of overlooking potentially fatal condition. To cut the long story short, there is a view that we blame everything on teething. Whilst parental belief about teething may interfere with health-seeking behavior and management of a wide range of serious illnesses which are attributed wrongly to teething. For example, diarrhea, a killer disease, and fever are regarded as normal phenomena that must accompany teething and are not viewed as serious enough to warrant medical attention. This is indeed worrisome, as serious childhood illnesses, which are unrelated to teething, are likely to be left untreated or may not be given the seriousness they deserve. It is important to separate facts from false beliefs about teething. Teething symptoms can vary, but do not typically cause severe systemic problems. Here are some commonly reported teething symptoms and ways to help your infant. Please subscribe to our channel for more information on staying healthy. First, the facts. These are the commonly reported teething symptoms and how to help your infant. Fact number 1. Children can develop irritability as a symptom of teething. This is caused by the discomfort of the teeth erupting through the gums. Often the first teeth and molars are the most uncomfortable. How to help your infant's irritability. Every baby needs some good cuddle time when they are having a hard time with teething. The extra time spent with your baby can help alleviate their pain by providing feelings of being comforted and reassured. Fact number 2. Children can develop saliva drooling, skin rashes as a symptom of teething. Teething can stimulate drooling, and many babies drool a lot. How to help your infant's drooling. Excessive drooling can cause a rash around the mouth, cheeks, chin, and neck area due to the extra bacteria on the skin from the saliva. Try to keep the area as clean and as dry as possible by periodically wiping the area. Applying a simple barrier cream can help with the dry, chapped, and sore skin. Fact number 3. Children can start gagging as a symptom of teething. The extra saliva produced during teething can cause an occasional gag. How to help your infant's gagging. If your infant's cough continues or is accompanied by a high fever and cold or flu symptoms, contact your doctor. The high fever with cold and flu symptoms is not related to teething, but is actually a sign that your infant is sick. Fact number 4. Children can be biting on any available object. The counter pressure from biting on practically anything can alleviate the pressure from under the gums. How to help your infant's biting. There are teething rings, and any commercially bought teething toys can help, especially when chilled. Do not use frozen teething toys. Fact number 5. Cheek rubbing and ear pulling. This is caused by pain in the gums, which can travel to the cheek and ear, especially when the molars are erupting. Infants will rub those areas. Keep in mind that ear pulling or rubbing can also be a sign of an ear infection. Please contact your doctor if this symptom continues or is accompanied with a high fever. How to help your infant's cheek rubbing and ear pulling. Try rubbing and massaging the gums with a clean finger for 1 to 2 minutes to help with the discomfort. Fact number 6. Some children will not have any of the symptoms, while some will have one or more of the symptoms. Please subscribe to our channel so that you can continue to get information about how to stay healthy. Now, the false beliefs. This list varies a lot depending on the culture in your environment. Lie number 1. Teething causes diarrhea. This is not true. Many believe that the increased saliva produced during teething can cause stool to become slightly loose, but not diarrhea. Keep in mind, diarrhea can be a sign of a more serious infection, so contact your doctor if the stool becomes watery, because your infant could be at risk for dehydration. Contacting your doctor is important if the diarrhea is accompanied by vomiting or a high fever. Lie number 2. When a baby is drooling a lot and chewing on everything, are teething. That is not always the case. Babies start drooling around 3 months, and drool even more as they get older. That happens if they're teething or not. Same thing for chewing. Babies love to chew on toys, toes, anything they can get their hands on, and they'll do this at 4-6 months old whether they're teething or not because they derive gratification from chewing at that stage. Lie number 3. Teething causes fevers. Teething doesn't cause fevers, much of that is coincidence. At the age children are teething, that's the same age their maternal antibodies are diminishing, and that they come in contact with lots and lots of germs because they have started moving around. So teething or not, kids get sick frequently at that age, which often gets confused with teething. Teething is not a cause of fever, especially a body temperature over 38 degrees Celsius. Lie number 4. Many people say that when teeth are coming through, babies are more susceptible to infections, because germs can get through the newly created holes in the gums. This is not true. Any temperature above 38 degrees Celsius is an infection, not teething. Lie number 5. Some people say that teeth cut through the gums as they grow. Interestingly, they don't. The body actually produces hormones that help break down the surface of the gums on top of the teeth, which then creates a hole for the erupting teeth to grow through. Lie number 6. Frozen teethers are soothing for a baby's gums. Actually, a totally frozen rock-hard object will probably be uncomfortable on those tender, swollen gums. A nice cold teether will be much better. Lie number 7. Teething causes vomiting. There is no data to justify this. Lie number 8. Teething causes cough and runny nose. This is not true. Lie number 9. Every child must have one teething sickness or the other. This is not true because many children develop teeth without any problem. Lie number 10. Teething causes rashes over the body. Just remember that many symptoms we think are teething can be associated with other illness which may be completely unrelated to teething and may need to be addressed by a physician.